Minister, what are you doing to curtail that, and will you extend the fourth booster to the whole population to protect them?
What we'll do is we'll continue to follow the medical advice. We will continue to put in place the winter preparedness plan, which we agreed with the states and territories and all the chief health officers and chief medical officer, which has been extending those vaccination boosters, particularly into the most vulnerable population. You'll note also in that New York Times article that one of the things they refer to was the strategic way in which we prioritised vaccines for the most vulnerable and elderly in our population, which was exactly our plan. That's who got vaccinated first, to ensure that we could minimise the impact on those most vulnerable populations. Now that has continued to be the medical advice, and the medical advice has not been to extend fourth doses. That is not, well, that's the medical advice. That is, we speak regularly, as particularly does the Health Minister. There's been no change to that advice. So we will continue to ensure that we follow that advice and ensure that Australia continues to have one of the most outstanding track records in managing the health impacts of this pandemic. But I would stress again, as I know the Premiers have on many occasions, what we are seeing now, when people are passing away, because there are more people who have COVID, that doesn't mean they've passed away because of COVID. And that is a very different issue from a public health point of view in terms of how you manage it. You ask me what we've done about it? Well, we have one of the highest vaccination rates in the world. The third dose rate is now just on the tip of 70%. This is one of the highest vaccination rates in the world. And Australians have got in there. This job is never done. And that's the job is never done, and that's why on each and every day, you know, the subvariants that we've seen come forward. These are issues I've been in dialogue with the Chief Medical Officer, and we watch that evidence very, very carefully. And if there are issues that arise, then we will act on them. But the advice we have is consistent with the approach that we've continued to take, and there hasn't been a change to that. And Australia has been one of the standout performers in managing COVID anywhere in the world. And I'd add this about COVID. We're living with COVID. I'll tell you what we're not going back to. We're not going back to those daily press conferences of people talking about COVID every day and putting the threat of shutdowns and lockdowns and interfering in people's lives again. I'll tell you, that's not what I'm going to do if I'm re-elected on Saturday. I'm not going to drag Australia back into those times again. I've noticed that Anthony Albanese is keen to get back into that type of approach. That's not the approach I've taken. I will answer every question on it, as I have for the last 2 years. And convened over 60 meetings of the National Cabinet to work with premiers and chief ministers around this country, which has ensured that Australia has had one of the lowest death rates of COVID anywhere in the world. Now, that's a record that Australians can be very, very proud of, and I thank Australians, particularly our health workers, particularly in Indigenous communities, for those working in aged care settings, for the amazing job they've done. What their work has done is enabling Australia to live with COVID without fear. And that's where our government will continue to take that issue forward.